Everybody, it's my pleasure to be here today. I am from Axios International, which, as our chair said, is an organization that specializes in improving access to cancer treatment and prevention in low and middle income countries. And I'm here today to talk to you about a subject that we haven't talked about yet, which is how the patients see their journey through the healthcare system. And I want to speak to you about some of the experiences we have from Ethiopia, where we have been running a project for the past 5 years on breast cancer. Some of you will be familiar with Ethiopia. It's a big country in terms of population. It's also a very, very poor country. And the maternal mortality is very high, which is normally a good indicator that the health system doesn't function particularly well in Ethiopia. And you can see there that they have a breast cancer burden that they have to deal with. Let's skip this one, go to this one. We started basically working in the main referral hospital of Ethiopia, Tigran Hospital, about 5 years ago. And the idea was really to strengthen the whole system around breast cancer in Ethiopia. So the first thing we did when we started in 2005 was to strengthen the diagnostic capacity with mammography, ultrasound, and ER/PR tests, which were non-existent when we started to work there. We worked on developing, treatment guidelines, palliative care guidelines, and we had a donation of Nolvadex for the project. Next year, it was more about the Ethiopian Cancer Association to increase awareness, to bring women forward at an earlier stage, and also to improve the patient follow-up and referral system, which was not systematized at Tigran Hospital. In 2007, we managed to get Arimidex available for our patients. We looked at Gondar Hospital, which is one of the other referral hospitals, to see if we could expand our program to another site. And 2008 was focused on training of the hospital staff. We are now in the last year of the project. We have focused on trying to develop a cancer registry proposal, and we did that because there is some political will in the Ministry of Health to look at chronic diseases. But as we all know, health planners need data to allocate resources. Without data, they don't allocate resources. So we wanted to help establish an Ethiopian cancer registry to get them that data and thereby move the cancer policy forward. So basically, we're now 2010, and we're looking towards some of the things we have achieved, as well as the lessons learned we have around the patient journey. I'm not going to go into a lot of details around this. This is just some of the technical results. We have, in the context of this project, done a lot of studies, a lot of scientific studies, looking at a variety of issues. And one of the things we wanted to look at was the patient navigation. What happens to these women? What has happened to them by the time that they actually present at Tigran Hospital? Where have they been? How long did it take? So basically, we set up a study where we took a number of patients who presented at Tigran Hospital, and 55 patients and 14 of their relatives, and we interviewed them about their patient journey. Some of the navigation chains that we saw, and I'll explain. Node is, how we characterize a site where the patient visited. A navigation chain is then the collection of sites or nodes, if you like, that this individual actually visited on her way through the system. And there are a number of different ones in Ethiopia. You have the primary healthcare clinics, you have sort of the local regional hospitals, you have military hospitals, and then you have Tigran Hospital, the main referral hospital in the capital. And not to forget, you have traditional healers, very important aspect of treatment and care in Ethiopia. Basically, if you look at the results, the overall results of the study, and I'll get back to that later on, you can see that the main sort of first node of entry into care was the primary healthcare site. We also have the local regional hospital as fairly important, but we also have the traditional healers. So a lot of women first went to traditional healers or the primary healthcare site when they suspected something was wrong with them. it's complex how patients' journey go through the system, very complex, and there's no straight line or any sort of straight way of doing it. On average, the patients who first saw traditional healers spent the most time going to different types of healthcare institutions before they ended up at the right point of care. You see here, the navigation chain. You can see that 26% of the patients actually went first to primary healthcare, regional hospital, then Tigua and Bessa Hospital, while, for instance, only 5% went first to the primary healthcare and then got referred directly to the right side of care, which was Tigua and Bessa Hospital. So patient knowledge of disease and what you can do about breast cancer is extremely limited. And all this affects, how they seek treatment. We have a number of patient stories that we collected, and, we have one woman telling us, around 4 years back, I started noticing a small lump over my right breast, but I wasn't that concerned. It really wasn't that important. Then after some time, I went to a private clinic, and a fine needle aspiration was done, and I was told I had breast cancer. We have another patient story here who started up with first primary healthcare, then local regional hospital, then Tigua and Bessa, basically saying she had pain, but she didn't do anything about it. She thought it was going to go away, but it got worse. And then finally, she was referred to a local hospital where she was told she had breast cancer. Traditional therapy is very important. They offer relief or cures as perceived by the patients, and they often complicate the treatment journey of the patient. We have a patient here explaining that 3 years ago she had this sensation, got worse, lump around the nipple, pain. She went to a local healer where she took medications, that's what they normally do, or holy water for 30 days. After the herbal medication, she says, my breast burst massively and prompted me to go to a hospital. So it took that much before she actually went to a hospital for care. And then after 2 years, she was told she had breast cancer, and she was finally referred to the main referral hospital. So in total, 28% of patients reached Tigua and Bessa Hospital at the second node of care, and 44% reached the care endpoint through referral to Tigua and Bessa as a third node of care. And an additional 27% reached Tigua and Bessa Hospital as the fourth node of care. So you can imagine how much time has been spent in a patient going back and forth between local providers and traditional healers. Patient-related factors, disbelief, lack of awareness, distance, expense of going to the capital. Even if you go to the capital, there's no assurance that people in Tigua and Bessa will be able to see you right away, so you have to pay for accommodation, you have to pay for meals. It's expensive for a poor patient. And again, we have stories here. 5 years back, I experienced an itch sensation over my left breast. Lump associated with pain arrived at a health center, from there to the local hospital, from there to Tigua and Bessa, but she couldn't get a bed in Tigua and Bessa Hospital. So these are the real sort of social problems of patients actually coming forward for breast cancer treatment. So she stopped, and afterwards she got worse, then she went to a private hospital. She wasted more than a year in this process. And then finally she had an operation, and she got referred to Tigua and Bessa Hospital, where they treated her.